Hello, my name is Sarah Oberhelman, and I am an Associate Consultant and Instructor of Medicine in the Department of Family Medicine at Mayo Clinic in Rochester, Minnesota. Our paper, Maternal Vitamin D Supplementation to Improve the Vitamin D Status of Breastfed Infants, a randomized controlled trial, will be appearing in an upcoming issue of Mayo Clinic Proceedings. This study randomized 40 breastfeeding moms and their healthy infants less than 6 months of age into one of two maternal vitamin D supplementation regimens. Either 5,000 international units of oral vitamin D to moms daily, or a single 150,000 international unit dose to moms on day 1 of the 28-day study. Throughout the study, maternal serum, urine, and breast milk samples were collected on study days 0, 1, 3, 7, 14, and 28. Infant serum was collected on study days 0 and 28. This study showed several interesting findings. For one, this study confirmed that vitamin D insufficiency is quite common among this population. At the start of the study, 18% of the mothers and 68% of the infants were found to have serum 25-hydroxy vitamin D concentrations of less than 20 nanograms per milliliter. An alarming 45% of the infants actually had serum concentrations less than 12 nanograms per milliliter. Throughout the course of the study, all of the 25-hydroxy vitamin D concentrations improved to exceed 20 nanograms per milliliter. In mothers receiving a daily dose of vitamin D supplementation, the mean change in 25-hydroxy vitamin D was from 28.8 nanograms per milliliter to 43.9 nanograms per milliliter. In the single dosing regimen, the maternal serum 25-hydroxy vitamin D improved from 29.3 nanograms per milliliter to 41.2 nanograms per milliliter. The infants who were in the daily dosing group improved from 16.9 to 39.2 nanograms per milliliter, and in the single dose group from 16.3 to 38.7 nanograms per milliliter. There were some differences seen between the two dosing regimens. The maternal serum 25-hydroxy vitamin D concentrations in the mothers who received the single large dose of 150,000 international units of vitamin D at study onset had a quick rise in their 25-hydroxy vitamin D concentrations. This then quickly decreased as well. The participants who were receiving the 5,000 international units of daily vitamin D supplementation had a slower rise in their 25-hydroxy vitamin D concentrations, but this was a sustained improvement from days 3 through 28 of the study. The maternal serum 25-hydroxy vitamin D concentrations improved from baseline in all study days in both dosing regimens. There was a statistically significant difference between the single dosing regimen and the daily dosing regimen in terms of the maternal 25-hydroxy vitamin D concentrations on study days 1, 3, and 7. Maternal breast milk cholecalciferol levels were also analyzed. There was a statistically significant increase in these concentrations compared to baseline in the daily dosing group on study days 3, 14, and 28, and in the single dosing regimen on study days 1, 3, and 7. There was a statistically significant difference between the two groups on study days 1 and 3. Finally, for infants, we only measured their serum concentrations on study days 0 and 28 to minimize trauma to the infants. The 25-hydroxy vitamin D concentrations of the infant's serum improved in a statistically significant way from baseline to study day 28 in both dosing groups. However, there was no statistical significant difference seen between the two groups. Finally, it's important to note that there was an asymptomatic increase in maternal urine calcium excretion noted. However, no hypercalcemia or any other adverse events attributed to vitamin D were noted in any study participants in either dosing regimens. Although additional longer-term studies are needed to confirm the safety and efficacy of these dosing regimens for the entire duration of breastfeeding, this study did show that in a 1-month period of time, maternal supplementation of vitamin D, either through a daily or monthly schedule, improved the maternal breast milk cholecalciferol concentrations to a level that improved the infant's vitamin D status via serum 25-hydroxyvitamin D concentrations to greater than 20 nanograms per milliliter. This not only would meet the infant's vitamin D needs, but would also meet the American Academy of Pediatrics recommendation that all exclusively breastfed infants be supplemented with vitamin D, as well as the Institute of Medicine's recommendations for vitamin D supplementation for infants not receiving enough vitamin D through the diet. For patients, again, although this might not be ready for widespread implication until longer-term studies confirm safety and efficacy, this study may offer breastfeeding families a choice. Would they prefer to supplement the mom or the infant? Would they prefer to supplement on a daily schedule or a monthly schedule? This study may show that any of these choices are reasonable. Additionally, if monthly schedules are chosen, this could theoretically be combined with the already established well-child visit schedule that infants and young children already follow. Next steps would require a study that looks at long-term safety and efficacy of maternal supplementation regimens throughout the entire duration of breastfeeding. Over the course of 6 or more months, do both of these regimens remain safe and effective? Does one of them become more effective? And are there any safety concerns over the long term? The takeaway points from this study are several-fold. For one, we again demonstrated that vitamin D insufficiency is a common manifestation in exclusively breastfed infants. Additionally, we showed that over a brief 1-month study, maternal supplementation, either through daily supplementation of 5,000 international units daily, or a single dose of 150,000 international units orally, improved breast milk cholecalciferol concentrations enough to improve the infant vitamin D status as measured in 25-hydroxyvitamin D concentrations.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.